Welcome to Eugeria Live, brought to you by Griswold Home Care. Eugeria is a Greek word meaning health of body and mind in aging individuals. Eugeria Live is a weekly show celebrating the heroes that contribute to the Eugeria of our elderly and disabled population. Now joining us in the studio are your hosts, John Butler and Brad Culp.
I want to welcome you all to this new edition of Eugeria Live. I'm John Butler. I have with me Brad Culp with Griswold Home Care and Germany with the Arbor Properties. And we're delighted to have everyone here with us, especially Ann. As you may know, Griswold has been providing in-home care for seniors in the Atlanta area for 28 years. And one of the things we do is provide services and education to those people who are dealing with seniors in their lives, whether it has anything to do with home care or not. And this is consistent with that thing that we've been doing for all these years. And Ann is a perfect example of someone who spends a good percentage of her time and energy helping seniors understand and navigate through the issues that they struggle with, especially during these challenging times. So I'm really thrilled to have Ann with us here today. Ann has been a marketing executive, owns her own marketing company for about 20 years, and she's been with the Arbor Companies for several years, Arbor Properties. Arbor is an excellent manager of senior properties. They have about 10 properties around the metro Atlanta area that they manage, and Ann is a key part of that process. So welcome, Ann, and thank you very much for joining us.
Thank you, John.
Let's start with a question that I think most people that are interested in senior living today are interested in, and that is there's a lot of fear about moving someone into a senior living community because of isolation, because of exposure, blah, blah, blah. What is it that you guys do that makes it safe for seniors to live in one of your communities?
John, that's an excellent question. I can totally understand the fear and the hesitation of families when they have a loved one that has needs and when they need to make that transition into a senior living community, and the hesitation right now in making that move. The Arbor Company started out in February of this year when COVID became a common word on everyone's lips before the CDC even started issuing recommendations for safety to put into place protocol that every single community followed and adhered to adamantly. We had calls on a daily basis with the leadership teams of every community. And during those calls, we went over, discussed, and watched the fluid changes that we needed to address literally on a daily basis. Because of the protocol that was put into place, the majority of our communities have had almost no impact from this COVID. If we have had COVID cases, then they have been very slight or asymptomatic at best. I know here at the Arbor Terrace Crabapple community in the Milton, Alpharetta area, we have had almost no cases at all, and the few that we have had have been completely asymptomatic. So following that protocol, requiring our families and everybody that steps into the community to follow it as well has been instrumental in keeping COVID out of our communities and making this a safe environment for our residents and our staff, as well as the family members.
And that's great information. It seems there can be an almost irrational fear on the part of families and residents in terms of moving into an environment that could be infected. How do you allay those fears in your residents and families and in potential residents and families?
It's interesting because I have this conversation on a regular basis with family members who reach out to us now that we are open and receiving new residents, is that how are you going to keep our family members safe? We require COVID negative tests results within a few days of moving in. And then we as a company will test that resident on day 1 and day 7 of that move in, as well as keeping them in a type of quarantine in their rooms for 14 days. Now, when I say that to family members, they immediately respond with our family members will be quarantined for 14 days, but let me show you what that quarantine looks like. In our communities, when we place a new resident in quarantine for their safety as well as the safety of our staff and our residents, even with that COVID negative result, it is not like they are being pushed in a corner by themselves. No, our engagement team and our leadership team literally interacts on a daily basis, 3 and 4 times a day. I know that the senior sales counselors and care counselors will go in 3 and 4 times just to make Zoom calls and FaceTime calls with that new resident and the family members. The care team goes in even more than they would normally do. The dining staff goes in, and also the engagement staff here at Arbor Crabapple will interact and do one-on-one activities, and then escort that resident outside to get fresh air and be a part of the activities in a way that is safe for them and the residents internally as well.
So does that also apply when somebody has to leave the facility, for example, to go to the hospital?
So when they go to the hospital, again, there's strict protocol that's been placed that has worked for these, 5-6 months. And when a resident comes back in from a hospital stay, that same quarantine protocol goes into place as well. Now, if somebody has gone to the hospital and they come back, they have a designated care staff that will interact with the proper PPE on, and that staff member is now responsible for that particular resident. What this does, it enables the leadership teams inside of our communities not only to maintain the proper distancing and the proper safety precautions, but it also allows us to track who has been in contact with what resident. And that is actually put in place with all our residents, whether it's in our Evergreen Memory Care community or here in our assisted living communities as well. So that if there is an outbreak or a COVID positive test result, and by the way, all our staff and all our residents are tested on a regular basis inside of these communities and have been for months and months through an independent private testing lab so that we can get those results turned back quickly. Then the staff has designated residents that they focus on so that we can track if there is a positive case that comes back.
I love what you're saying about the extra attention that the residents get as they move into the facility for the first time or they come back from a hospital stay. I wanted to ask you, and it dovetails nicely here, I wanted to ask you about the isolation factor, because I think a lot of people, when they think about their loved one in a community like this right now, they think isolation, no socialization, and my mom's 89 years old. She doesn't know how to use FaceTime or Zoom.
Right.
Tell me about how you keep your residents engaged and keep them socialized so that they don't start to suffer from depression or these feelings of isolation.
So isolation is so important to address here. Education is a huge component of what I do for families and the communities that I work with. And one of the things that I spoke to before COVID even was impacting our communities here in assisted living and senior living and externally, personally with all of us, was the fact that a family member could be in their own home feeling very independent, correct? And yet, if you really take a step back and look at what that social interaction is, they are isolated. This is before COVID. They may go to church once a week. They may go to the grocery store. But Johns Hopkins, Emory, the Mayo Clinic have all come out with studies that have said the biggest impactful item in somebody's life that slows down the natural aging process as well as cognitive decline like dementia is regular, daily, expected social interaction. So what does that mean inside of a community during a COVID time? Our engagement team here at Arbor Crabapple has activities set up 7 days a week. Our staff goes in these rooms and does one-on-one with these residents. They bring them out in the hallways, and they are probably 8 feet apart, and they do hallway activities. We have socials. My goodness, we had a huge drive-by birthday party on Saturday that I was out dancing and singing in. Probably shouldn't have been singing that loud, but it was fantastic. We had about 10 cars that had balloons and they had flags, music. We had the residents socially distanced outside so that they could not only engage in the party aspect of the event, but also help cheer on the family members and the friends that drove by. That was like a 45-minute event. That was huge. And this is a daily thing. We have not missed a beat inside of our communities. So when you talk isolation during COVID, if you're at home and you're having your groceries delivered and you're not able to talk to your Sunday school class or your friends or go out to dinner or see your family members, that is true isolation. And not only that, Brad, you are at risk at home at a higher level than you are in a community like ours, where we are constantly checking people's temperatures and their backgrounds and where they've been, and limiting who are the regulars. And I say regulars, we have regulars that are allowed to come in, like nurses and PT people, but that's it. And our staff has been tested since February. That's huge, because we are able to tell you exactly who has had a cough, who has had a fever, and who has had a positive for COVID, which has been almost no one. And then when they do, the Arbor Company supports our staff so that they are allowed to go home, they're allowed to quarantine, and they're allowed to have, free testing and free medical visits so that they can get well and come back and help take care of our residents. That's how we've addressed the social isolation and the care there involved.
Thank you. For your staff, what have you experienced in terms of their level of confidence in Arbor protecting them, keeping them safe? And have you had challenges keeping staff in your communities, or has it turned out that they're very confident in what you're doing and in their own safety?
So one of the things that makes Arbor Company who they are, why they've been successfully in business for over 30 years now, and why they're able to maintain tenure of staff, is because they look at their residents and their staff equally. Staff is as important to the Arbor Company as the residents. So when COVID opened up, what happened in our communities? I'm talking about externally for all of us. Our children stayed at home. All of a sudden, you've got workers with small children at home. You have school. You have issues with childcare because all of those places closed down as well. The Arbor Company stepped in and we said, we will pay for your childcare. We will pay for any assistance you need with the education aspect of your children at home. We will give you the free medical support that you need if you are concerned if one of your children has a cold or a cough or exhibiting any symptoms, or you yourself. And you will not have your pay or your paid time off docked if you have to take time off. That type of support, and knowing that the communications is there and the doors are open, is not a COVID-related situation that the Arbor Company has. The Arbor Company has always maintained those standards. That's why I think in a place like Arbor Terrace Crabapple, our nurse with the lowest amount of tenure is 3 years. And we have 9 nurses on staff here. That means, Brad, that the other nurses have been here for longer than 3 years. Now, you've been in this industry for almost 30 years. You know how difficult it is to keep nurses on staff 5 days a week at most assisted living communities. 1, maybe 2. We have 9 that are here 24/7. So that tenure speaks to how supportive the Arbor Company has been. So no, we haven't lost workers because they're afraid. They've actually embraced our support. We've allowed them to order food so that, it can be delivered here so that they don't have to expose themselves going to the grocery store or even have to go to the grocery store when they leave work. Just the little things like that make a huge difference after you've worked a long shift. And now you have to think, I have to go to the grocery store, and people could be sick at the grocery store, but I have to go anyway. Well, now they have food here delivered so that they can take those groceries straight home. That's just one example of the many things that the Arbor Company has done during this COVID period.
Sounds like a great place to work, and that can't help but translate into a more positive customer experience.
Well, We have been inundated here at Arbor Crabapple with positive reviews, positive emails from family members. And here's what they're saying, Brad. Thank you for closing down the community as early as you did. We were one of the first communities, the Arbor communities are one of the first assisted living and memory care, senior living communities that closed down. Thank you for not allowing us in. We miss our loved ones, but we appreciate the fact that you are willing to take a stand and that their safety and wellness is priority on the top of your list. Thank you for not taking in new residents during the height of COVID. We have received so many emails that have thanked us from family members. And that to me speaks volumes on what we're doing, to have that kind of support. I've heard news reports from other communities. The news, I think, is showing senior living, showing care industry partners like you guys as not really focusing on the residents, being more concerned about revenue, bottom line, surviving through the economic decline. I think we all have done an amazing job. I know home care people like your company, the challenges that you're faced with of sending in your workers into people's homes, making transitions while the family members are waiting to move in, and then helping and partnering with communities like ours to assist us with additional care because family members can't come in during that move. I think it's an amazing thing that this industry has stepped up and really done the right thing and made the right choices for all the right reasons.
You're clearly proud of what you've been able to accomplish and what the Arbor Company has been doing as a result of this pandemic. If there's one thing that you're most proud of, what would that be?
When people ask me what it's like to come into a senior living community every day, because their natural assumption has been I've been working from home since February. And actually, the leadership teams have been working 7 days a week, manning all the shifts to ensure that the protocol is followed. Because we're all human, and we do know that sometimes you forget to do everything 20 seconds of washing your hands or temperature taking. I am the most proud that the leadership at the Arbor Company has stepped forward and set the example and the standards and allowed the people in the communities to focus on the wellness of our residents and our staff. I'm proud to walk in every day when people are scared to leave their houses and say, I work in probably one of the safest places in this country right now. Here's a great example of my putting my actions where my words are. I have a daughter with immune deficiency living at home. If she gets COVID, her chances of surviving are very, very slim. That's from the mouth of my brother, who's a doctor at CHOA. When the virus first came out, he said, you have to quit your job. He said, you can't risk her health. And I said, Joe, I think I work in one of the safest places to be right now. So safe that by the time May rolled around, my daughter from GT, who is home because the school's closed and she couldn't, get a job anywhere else, came to work for the Arbor Company here at Arbor Crabapple. She became part of the engagement team. And I let her come into this community to work because I knew that it was one of the safest environments for her to be in, to be able to walk back home and into our house where she could potentially bring harm to her sister. So I am the most proud of the calls, the tough calls that this company has made during this time. But again, like I said, Brad, they're only an extension of how the Arbor Company has carried on business for 30 years.
That is really an impressive story, and it speaks volumes for what you've been talking about.
Thank you.
Those of us that will be listening to this that are just in general struggling with what to do with mom or dad or whatever, and it may or may not be a decision about moving into a senior living community, or it may be. Is there one tip that you can give a family, particularly an adult child perhaps of an aging parent, that you could give them to help them through this uncertain time?
If a family is looking to move a loved one in during this particular time, I think you go back to the things that you look for when you're looking for a transition community for your loved one before COVID as well as COVID. Obviously, talk about the protocol that they put in place. Obviously, talk to and ask to talk to family members who have residents inside these communities, because that's truly where you're going to hear the truth. I feel fortunate because my mother lived here for 5 years before she passed. I can actually talk to family members and say, this is what it was like here when my mother was here. This is how that care was. This is what the food was like. This is how they reacted when I complained. I love the fact that I can speak from the other side of the table as well. So to a family that's looking, that has that need and has to do it now during COVID, check the protocol. But talk to the family members and say, how has mom been through this? How have her spirits been, and how has the team stepped up to address them? I'm sure if you are parents, you know that in a crisis mode and your children are crying, your focus is on putting that fire out. And a lot of times you're not going to check on little Jimmy or Tom. You need to put that fire out, and then you go back and you address and make sure their knees aren't scraped up too badly or whatever. Communities shouldn't react that way to their residents. They should be concerned about if that resident is okay and be able to put the fire out at the same time. It has to be done. There can't be an excuse. So if you talk to a family member, ask for a list of names. It's that simple. I mean, you go to Google and get reviews, but if you talk to that family member, you're fixing to make a decision about one of the most important people in your life. You need to check it out. And that would be my recommendation.
That's excellent, Ann. Thank you so much. It's really been great to hear and to speak to you and to learn more about what you do day in and day out to make lives better for seniors and their families. And we really appreciate the opportunity we've had today to just listen to you and talk to you. And I hope to see you again soon.
Thank you, John and Brad. I appreciate the time. It is one of my favorite things to talk about, as I guess you can tell. Thank you, guys. Everybody stay safe, and I look forward to seeing you two again, hopefully in person.
Eugeria Live is brought to you by Griswold Home Care. View this show again on YouTube, Facebook, LinkedIn, or our website at www.eugerialive.com.